Welcome to the program. Thank you so much for tuning in. I'm your host, Neal Howard, here on Health Professional Radio. Prenatal vitamins come in many different forms and doses, and our guest today is Dr. Bradley Price. He's going to talk about prenatal vitamins and hopefully clear up some misconceptions about them, and also talk about an upcoming policy decision from a private company to make all prenatal vitamins over-the-counter vitamins as opposed to prescription. Welcome to the program, Dr. Bradley Price.
Thank you. Thank you. Glad to be here.
Give our listeners a bit of background about yourself.
Well, I've taken care of pregnant women for a little over 40 years. So I know a lot about what kind of vitamins they're willing to take and what problems they will have over time with the different kind of vitamin ingredients.
Okay. So the types of vitamins that they're willing to take and some of the benefits, what are the benefits?
Sure. The key components of any prenatal vitamin are iron and folate. And those two components are very important for preventing anemia for the mom. If particularly iron deficiency is very common in childbearing age group, and it's hard to get, almost impossible to get enough iron in the diet. So iron supplement of some sort is absolutely necessary. Folate is also key, not only for the mother to help prevent a certain type of anemia, but also for the baby. It's key for what's called a neural tube, the formation of the spinal cord. So some women with low folate for metabolic reasons will tend to have a much higher chance for a baby with spina bifida and other variations on that.
And being that important, why is it that, you mentioned that you're knowing what some women will choose to take or are willing to take. Why would a woman choose not to take prenatal vitamins?
Well, a lot of it has to do with just compliance, creature comfort. For instance, if she gets a vitamin that is big, I've heard patients call them a horse pill, and they basically just refuse to take them or have a great deal of difficulty swallowing. So one thing is just the size of the tablet. So with a prescription vitamin, I have a real good idea what a particular brand, what the size is, whereas generic, they're all over the map in terms of that.
Well, size, it seems that these days size would, if that was an issue, that it would be addressed. An easy fix why is that not an easy fix?
I think that some vitamin makers want the kitchen sink in their vitamin, and they want so complete that it ends up being big. Particularly, I think calcium is one of the ones that takes up a lot of space. Mm-hmm. So that's the problem, that tension between lots of ingredients versus size. But a well-engineered prenatal vitamin can have plenty of adequate ingredients, particularly iron and folate, and still have minimal size.
Well, are prenatal vitamins always necessary during pregnancy? Is that they have to be taken, or can she do okay as far as pregnancy is concerned without having to deal with the size or the pill at all?
Really, it's impossible to get enough iron in the diet, even meat eaters.
Oh, okay.
And the other thing, that the folate is key, particularly early in pregnancy. But the iron is the absolute key, and so some women, if they don't take their prenatal on a regular basis, or sometimes they're embarrassed to say they're not even taking it, and it will show up in labor profoundly anemic. Then those women, if they have any bleeding more than average during delivery, are much more likely to have to get a blood transfusion.
So it's not just a simple cut and dry sort of issue when dealing with prenatal vitamins. How do you, determine what type of prenatal vitamins are right for your patient?
Well, I think that's something that ideally every doc should talk with every patient, because every patient's different. There's not a one size fits all. Besides size, what I look for is the type of folate. folic acid, and that's one of the, as I say, one of the key ingredients of prenatal, 1,000 micrograms of folate or gram. And so one of the best folates is methylfolate, which is it's body ready. It doesn't require an enzyme that it turns out a large majority of Hispanics in the U.S. lack appropriate amount of an enzyme to convert standard folate to the active form of folate. Methylfolate, on the other hand, is available in some prenatals, and it's already body ready. So that woman that doesn't have adequate supplies of that particular enzyme can do fine and build up her folate level without problem. That's one of the keys. The other absolute key that relates to compliance that is how people feel on their vitamin is iron. And so a lot of iron in most, say, in over-the-counter is so-called iron salts, like ferrous fumarate, ferrous sulfate. Those are the ones that are poorly absorbed, and they end up aggravating the woman's acid reflux, which she already has, and constipation. So many times the patient will take those and get those kind of symptoms and quit taking it. So there are some variations on away from the iron salts. There's a chelated iron called ferrous aspartoglycinate or sumalate, which has amino acid, aspartic acid, and glycine on each side of the iron molecule. That ends up being absorbed like an amino acid, so much more efficient. And so that reduces a lot of the iron side effects.
You know, Dr. Price, you mentioned that being a physician and writing these prescriptions, when it comes to, I guess, tailoring a woman's prenatal vitamin regimen, you've got a little bit of control there. You can consult, and as you said, knowing specific brands and whatnot and what the characteristics of those brands are, you can better prescribe different types of vitamins. But there's a recent decision, a policy decision from a private company that's going to remove that little bit of control that you have as a physician. Am I correct in that?
I am, yes, and I'm very worried about that pending change. I think it's called First Data Bank, a policy decision. And so that's, I think, a world of trouble.
If women are already having trouble with the size and knowing, you know, which vitamin is best for them based on their situation, I guess part of your fear lies in the compounding of that confusion. Right.
It gives the doc much less control over what the woman is actually taking. And so like I say, I think compliance is what I'm worried about. Compliance means how well that a patient will actually take a medicine. The other thing that bothers me about the compliance issue is that a majority of deliveries in the U.S. are paid for on Medicaid. And currently Medicaid pays for prescription vitamins, but not over the counter. So if it went over, prenatals went over the counter, women on Medicaid would probably have to buy on a cash basis their over-the-counter prenatals. And a lot of women on Medicaid just can't afford it. So there goes another huge stumbling block towards good compliance.
Do you, and I know this is an opinion type of question, maybe some possible collaboration between Medicaid and some of these providers to change policy on the part of Medicaid to begin to pay for these over-the-counter drugs, specifically, not across the board over-the-counter drugs?
I think that would be an appropriate step. For instance, in the state of Texas, where I practice, there is a Medicaid formulary committee. So that would be the group that would decide basically what's covered, what prenatal vitamin is covered. So that would be a discussion to take to that particular committee. I'd be happy to carry. And so, yes, that would be a compromise, so it's not just totally chaos.
Well, I appreciate you coming in today, Dr. Price, and I'm hoping that you'll come back and talk with us in the future, give us some updates as maybe some of these policies will change on the part of Medicaid to allow some of the women who are already enjoying those benefits to continue to enjoy those benefits regardless of this decision by First Data Bank. Learn more at www.rxprenatalvitaminaction.com.
That's right.
Dr. Bradley Price talking about prenatal vitamins. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at healthprofessionalradio.com.au and at hpr.fm.